Since the Centers for Disease Control and Prevention reported the first known COVID-19 related death on February 29, 2020 in the United States, undertakers and funeral directors have been struggling to handle the grim task of interring and cremating the deceased. Nowhere is this more acute and intense than in New York City, where the health department has been working overtime to issue death certificates, and cemeteries across the tri-state area have become inundated with more than 100 daily requests for burials. This week I did a virtual sit-down with Sekou Johnson. He is a Grenadian American funeral director who is one of the hundreds of funeral directors and undertakers who serve in an army of last responders fanned across the city with the task of quickly having to repose the remains of those who succumbed to the virus. Sekou serves the residents of Brooklyn and Queens, two of the hardest hit boroughs in New York City, which is also home to one of the most significant Caribbean diaspora populations in all of North America.
And no one was really prepared to face something of this magnitude. From the hospitals, to the cemeteries, the crematories, the funeral homes, the medical examiner, no one was prepared to handle this right now.
Mm-hmm. So your turnaround for burials would be, you get a call that someone passed away. What does that turnaround look like? Is it a couple days, 2 days, 3 days?
Another thing is that the hospitals are pressuring families because they also have the problem of storage space. So they're actually calling families and funeral homes to get the body out of their facility as quickly as possible. So I have an option here now that I use a cemetery in Long Island, Farmingdale, Long Island. And what it is, the cemetery is a huge cemetery. So their waiting time is 48 hours. But it's kind of pricey. So most families are tending to go for that, because of the convenience.
New York City, up to this point, has been the epicenter of this deadly global pandemic. As of April 22nd, 2020, the city recorded 11,267 deaths. During the three waves of the 1918 influenza pandemic, the city recorded 30,000 deaths out of a population of roughly 5.6 million at the time.
From within a month, I've dealt with about 17 Grenadians. Some may have been direct dispositions, no funeral service, just a direct cremation or a direct burial, but in all about 17.
Johnson says that because of the high demand for burials at local cemeteries, many families are choosing temporary internments at Hart Island, a burial ground used in the past for AIDS patients, lepers, and for the unclaimed and those who were part of the impoverished class in New York City.
Only option the city has is a temporary burial. And what that means is that the bodies will be interred in Hart Island, that's off of the Bronx, in a cemetery called Pottersfield. That is where they would normally bury unclaimed bodies. A temporary burial now is that when the family gets themselves together, maybe financially and otherwise, they'll then exhume that body and give their loved one a dignified burial and funeral. Mm-hmm. So that's the only alternative the city is making available to the public right now. Oh yeah.
How are you coping with the volume, personally and professionally?
In fact, it took me 2 days to prepare myself for this interview because I had to eat properly and get some rest.
Yeah.
So I took yesterday off and today off from dealing with anything to do in the funeral home. These 2 days were just for me to regain composure and my sanity. And I'm looking forward to the weekend.
Reporting from Washington, D.C., this is Kellon Bubb.